Thanks. Thank you, Hanu. Good morning, everyone. It's really good to see everyone here and meeting many of you for the first time, face-to-face, even though it was the end of the project. But yeah, really good event. Thank you very much to the organizers for hosting and for a lovely dinner last night as well. So I'm just going to give an overview on the work that's been done on Work Package 9 and maybe a couple of recommendations or comments at the end. So the scope of our work package was to promote a more standardized approach to chemical preparedness and response via increasing the exchange of information and promoting good practice between EU member states. We aim to strengthen IHR compliance in Europe and ensure that chemical obligations of the IHR are met. Because it's an all hazards approach and chemicals can often sort of fall by the wayside, so it's our job to fly the flag. And some of the other aims of our work package, including improving implementation of chemical core capacities, strengthening preparedness and response planning for chemical events, identifying and strengthening gaps in IHR compliance, such as chemical surveillance, among others, and the standardization of procedures for preparing and responding to chemical health threats. So even though it's just me up here, there's been a number of people involved. Here we have the UK HSA team and our colleagues in Slovenia from NIJZ. There's even more names there. I forgot to add them all. I know Claudia and Viviana, sorry I left you off the list. We had quite a few partners involved, although they sort of rapidly dropped off once the pandemic hit. Although I should mention Elizabeth Hall from RIVM has also done a lot of work with us as well. So here are sort of the deliverables and milestones and the tasks which I'm going to go through now. We had sort of about 6 main tasks which I'll talk through and hopefully update on some of the results. So the first task was a gap analysis. So we wanted to do a fact-finding or gap analysis to determine which areas required further action in our work package. And it was also for us to inform us the kind of areas we should be looking at for some of the later tasks that I'm going to talk about. A questionnaire was designed and distributed to SHARP partners, and we received 19 responses from 14 member states, which is not bad considering we sent it out in the middle of 2020, which wasn't the best timing. The results were collated and written up into a fact-finding report, and responses were received on questions concerning chemical preparedness and response, poison centers and surveillance, existing mechanisms for chemical alerting systems, for example, chemical laboratory analysis and training requirements. So picking up on many of the tasks that are on the list as well. The report also incorporated results from JEE and SPA reports from EU member states, and some of the results from one of the first workshops Work Package 5 conducted in Latvia as well, back in January. So here we delivered the fact-finding report, D9.1, and the gap analysis questionnaire also met our obligation for stakeholder consultation. So task 2 was to strengthen existing mechanisms. And what we aimed to do here were to take outputs from previous relevant projects and other existing mechanisms for response to cross-border chemical incidents. At the time, I was involved in the SHEAR committee, the Scientific Committee for Health, Environment and Emerging Risks, as they had a lot of mechanisms for sharing information on cross-border chemical incidents. In addition, when we put the proposal together, the question came up from the Commission that we should look into establishing an EU response network for chemicals. So that was one of our other deliverables. We did a scoping report on a chemical laboratory response network, sort of to mirror some of the microbiological networks which exist across EU member states. So for this, we produced a report on the desirability and feasibility of establishing such a network. And this was done, through the questionnaire, where we asked participants whether they would be up for joining such a network and whether this would be feasible for them. Overwhelmingly, they all said they would be willing to have such a network, although there was less sort of confidence on how feasible this would be and whether they would be allowed to, and sort of all the complications around that. But anyway, we also included some interviews we conducted with members of existing similar networks, such as environmental, microbiological, and toxicology networks as well. So task 9.3 was surveillance. So what we wanted to do here was just sort of raise awareness and provide means for countries who don't have much chemical surveillance to adapt and uptake such systems. So as a first step, we were asked by the Commission to include a literature review to provide examples of good practice and opportunities to implement surveillance of chemical incidents. So due to sort of some staffing issues caused by the pandemic, the literature review it's taken quite some time, but it's been conducted, it's pretty much finished, and is currently being formatted for submission. We also produced a very large document on surveillance. We call the Surveillance Strategy Report. Includes a wealth of information, including definitions, extensive background on different types, methods for surveillance, for chemical surveillance, and examples from multiple countries. It also included a wealth of information on governance, funding, and ethics when you establish such a system. It's been completed, and we're just awaiting for internal approval to submit to the coordinators. So I know it's late, I'm really sorry. But it's done, and it's coming. So task sort of 4 and 5 were the development of training and exercise materials. So for this, we produced a variety of training materials, including lectures, various case studies of chemical incidents, exercise scenarios, and interactive activities. And using these materials, in collaboration with Milena Marie and Work Package 8, and also Work Package 2, in particular, Karen Dancy, there you are, we delivered the first workshop to 27 participants, and the second one to 83 participants. And I think Karen was a key player in getting so many people involved in the workshops there. So a real collaborative effort. So finally, sorry, still going. The topics were informed by the results of the gap analysis questionnaire and included a session on IHR for chemicals, chemical incident preparedness, response, risk assessment, multi-sectoral preparedness and response when dealing with chemical incidents, and recovery from a chemical incident. We also had a session where we presented a chemical incident scenario, and participants were asked sort of many questions, and our civilian colleagues did a great job with a load of Menti questions to make it more interactive. So it's pretty successful. So the workshops were fairly similar. Our intention was to hold a workshop, collect feedback, and improve for the second one, which we did. And the content and results of the workshop were written up into a training and exercise report, which has been delivered to the coordinators. So this hits our milestones for materials, workshops, and the report as well. Evaluation was overwhelmingly positive. I think everyone who responded to our evaluation said it was either sort of very good or good, and all of them would recommend it to a friend. So that was very nice. It also threw up, they gave feedback that they basically, participants wanted to see more of this. So it's really good to see that sort of the continuation of, and provision of this training is going to go ahead, because I think people were crying out for more and more of this stuff. Finally, our last task was to produce SOPs. I see this more of a guidance document. I don't think some guy from UKHSA can tell all the UE member states how to do things. But we were asked to call them SOPs. So it's sort of, we've produced a variety of guidance documents with a suggestion on how to implement such a procedure. So they are suggestive, they're not, not telling you what to do. They contain a lot of background information and signposting to further resources and examples. And again, the list of topics was informed from our fact-finding report, surveillance activities, and feedback from the chemical workshop and laboratory network report. So they include surveillance, including event-based surveillance, which is a very quick and easy thing to sort of set up. Risk analysis of chemical health threats, multi-sectoral collaboration, decontamination, sampling and detection, and recovery. So the SOPs have been drafted, and we're currently finalizing the SOP report for submission, which is our 9.4 deliverable. Excuse me, and a final deliverable was a final report where we sort of summarize everything we've been doing over Work Package 9 for the last sort of 4.5 years. So I think that's due next month, so we're just finishing up. So just to summarize the completed activities, this sort of represents all the milestones and deliverables we hit so far. We had an initial kickoff meeting with Work Package 9 partners held in Ljubljana in October 2019. The gap analysis questionnaire was designed and distributed, and the resulting fact-finding report was delivered. We again delivered the report on desirability and feasibility of an EU chemical network, designed and developed training materials, held the workshops in collaboration with Work Package 2 and 8, and produced and delivered the training report. So the last few things is to hand in the strategy report, which is just waiting sign-off from our organization. To finish off the SOP report, now the SOPs have been drafted, we have to, what we did with mechanisms for cross-border chemical health threat preparedness, in our second task, we collated a load of useful resources from previous projects and other mechanisms, and we've put them together, and we're just sort of writing up a document containing hyperlinks and support to use these resources. Things have changed quite a lot in the past few years, so there's going to be a few caveats in there as well about what has changed. And the final report, which is a summary of all our activities. So we're getting there. Like everyone else, we faced many challenges in Sharp, most of them stemming from the COVID pandemic. It's really affected us mostly on the basis of reduced staff capacity, as many staff were pulled away from chemicals to work on the pandemic. And as such, we had to change quite a few things. Our workshops were carried out remotely over Zoom, and they were very successful thanks to Work Package 8. So we would have done those face-to-face. And we also had to change a few other things, like conducting exercises and other trainings. However, myself and partners in Slovenia, we held in there, and we continue to meet regularly and working towards the deliverables, which we've almost completed. So thank you very much for your support. So some observations on continuation after Sharp. Some of the activities have potential for further work once the project's ended. I mean, one of the particular ones was the chemical network. The report demonstrated that there is a serious appetite for something like this. And although it's sort of difficult, it's definitely feasible based on existing networks. So in the report, we suggested some next steps which could be taken to start the process, and we hope this will be followed up in the future. As I mentioned, the training materials are available for further use, and it's encouraged that sort of further chemical training is conducted, as participants were crying out for it. And likewise, the strategy report contains a really large amount of information on setting up and maintaining surveillance systems for chemical incidents. And we hope it's sort of utilized and taken forward after Sharp's completed. Oh, and that's it. Thank you very much.
Okay, thank you very much. Sorry for this technical problems. So just concerning some points raised in the previous presentation, I'd just like to say very briefly before my presentation that concerning the standard operating procedures, we will consider and think about it. Of course, we are happy to share any all results from the Sharp project and try to support the outcome and the implementation of the outcome. Concerning the network of chemical laboratories, we have to consider a little bit more with internet services. It's raising also some question who should host that network and so on. So it needs a little bit more consideration, but we are open and positive to examine the possibilities in this regard as well. I'm coming to my presentation now. I changed slightly the title. I'm trying to explain to you why. So we are. I will tell you some details what we are planning to do and what we are doing already now concerning chemical threats reporting, according and in line with the Serious Cross-Border Health Threats Regulation and in the European Early Warning and Response System. I'm trying to give you a little bit of an overview about the evolution of the EWRS and how chemical threats reporting been addressed in the past, what is our presence, and what we are going to achieve in the future in this context. And of course, I will refer to the relevant provisions of the cross-border health threats regulations as well in this context. So I will just trying to move my presentation. Okay. Okay, so here we go. So I would go back very briefly to the EU decision 2013-1082, which was reacting the EWRS after it was initially established in 1980. And also for the first time extended the scope of the decision from biological threats to other threats, cross-border threats to health, including chemical, environmental, and unknown origin. So this was the first time that the all threats approach to notification of cross-border health threats was introduced in the EU. Another piece of element in this evolution of the EWRS was an important one, the European Court of Auditors report from 2016, which called for action, among others, to making upgrades to the EWRS and called the Commission and also in cooperation with member states to examine options for modernizing and enhancing the EWRS based on regular feedback from users. Another important piece of guidance for the EWRS and for the communication between the Commission and the Member States in this regard was the Commission Decision 2017-253. And this stated and called the Member States to ensure effective communication channels between the different competent authorities within the jurisdiction to promptly identify serious cross-border health threats to health, meaning not only like biological, but also other type of threats should be properly notified and followed up by the Member States in cooperation with the Commission. And now we are coming in from the legal part to the present situation. We have the 2022 regulation, and this particularly addressing chemical threats in Article 2, describing the scope of the regulation, and that's where in paragraph 1 is the chemical origin threats are listed, and also environmental origin threats and unknown origin threats. And here again, the Commission is called together with the Member States to ensure coordination and information exchange between the mechanism and structures relevant for prevention, preparedness, response, and monitoring and early warning of serious cross-border health threats in the described scope. Another point where chemical threats are mentioned, actually the regulation, and the very important one concerns public health risk assessment in Article 20. And this is a very new point here, like the rapid risk assessment of chemical threats should be done in cooperation with union agencies and other bodies. And here, first place, European Chemicals Agency is mentioned for the threats which fall under the mandate of the ECHA. Of course, when needed, other agencies and bodies could and should be involved in the rapid risk assessment, what the Commission should be sharing and with the Member States, according to Article 20. So this much about the legal basis and the evolution, legally speaking, about the EWRS and chemical threats reporting. Yes, this is also the first mention of other alert and information systems which should be connected or interlinked with the EWRS. This was first mentioned in the 2017 decision. It's listing 11 different alert and information systems, which should be progressively linked to EWRS. And on the little colorful figure that, in the right bottom corner of the slide, you can see that there's a couple of different information systems which are relevant for chemical threats. They are mentioned there: Ecury, RAPEX, RASCHEM, NPS, and Argus. This is just to give you a bit of an overview what happened in the context of all threats approach, and including chemical threats notification and information exchange. So the figure is quite self-explanatory here with a little table. It shows us that the reporting all threats approach, including chemical threats, remains a challenge. So the overwhelming majority of all the notifications until the recent past was happening concerning communicable diseases. There was hardly anything reported in chemical threats and environmental threats or unknown origin threats. And I'm referring back again here that the member states shall ensure effective communication channels between the EWS competent authorities for all threats. Now, of course, the Commission shall ensure the appropriate conditions for this. And I'm coming to the next slide now and trying to explain to you how we are planning to do that based on all the legal evolution of EWS and chemical threats reporting and all the experiences with a number of notifications received in the different threats subcategories. So first of all, I'm telling you now that exchange of information is ongoing between the EWS and several other EU information system, alert and information system. Collaboration is already existing with Argus, RAS, ADIS, ERI, TC, and tissue cell and blood part, the NPS, new psychoactive substances, and ECURI. There are already some collaboration being set up with RAPEX, but not really much is existing yet with EMAS and Eurofit. And we are considering, of course, other information system to be linked with the EWS, like the EU Climate and Health Observatory, EpiPulse, the Athena, the HERAS new system, which is coming soon, and the notification system under IHR. And we are also in discussion with colleagues in DG Employment to see if they can interlink some of their work to the EWS to achieve overall all threats approach concerning notification of any serious cross-border threats to health. The feasibility of assessment of further exchange of information between EWS and other systems are also ongoing. This is an external contractor which is doing this work, how the different system can be linked to the EWS. I mean here like different IT requirements to somehow to bring into harmony a little bit the different data fields which could be then shared between the interlinked systems. And then for the future, I could say that under point 3, that finally all EWS, national competent authorities, should get all the relevant notifications which are relevant to public health. And yeah, so that should be the final outlook and the final perspective for the EWS system, which will include then all threats relevant for public health, including chemical threats and environmental threats and unknown threats of chemical origin. Just a little bit of an overview of all the other systems we are checking now and which are under assessment by us and by the external contractor for interlinkage with EWS. Many of them, of course, very much relevant for chemical threats. And yes, and a very important, maybe the core of our work now, what we are doing at the moment to renew the notification of threats of any kind of chemical origin, including chemical, environmental, and hybrid threats. And this is the revision of the EWS taxonomy and the reporting fields for notifications. We are aware, and we concluded based on the past work and also the past experience, what you have seen on previous slides, that we need to review the chemical and environmental taxonomy for notifications to be able to improve the number of notifications and the coverage of the whole notification system on chemical threats. And there is currently ongoing work on assessment, the current taxonomy. And I will come to that in the next slide. And there is also another piece of important part of this work, which is the IT-related work, which is again being done with an external contractor to enable all the IT systems behind the different notification system, that the interlinkage is possible smoothly and efficiently. On the yellow, on the right bottom corner, you see the future. So we have at the moment biological plus unknown alerts mostly in our notifications in the EWRS. A future should be like chemical, environmental, and hybrids that's included. I don't have too many more slides. Just wanted to share you the past, or the presence, current taxonomy. This is product-based, as you can see. The future, what we would like to achieve is agents-based. That means we would have like substances in our notifications, not different groups of products. I guess I'm a bit running out of time, right? Can I still finish my? Okay, so I'm just, maybe this is my last important slide for the external contractor who is working on the renewal on this new taxonomy. Is the starting point the ASHT project, which identified 99 chemicals and chemicals emergency risk management sheets, the RASCHEM project, the HMNet, and the SHARE committee's outcome. So that will be used by the contractor to check what is available at the moment and what we expect from him, a list of chemical agents that can cause SCBTH,